Hello, everybody. Welcome to our conversation today. Today, I have a very special guest with me. Dr. Robin Root is a clinical psychologist from Palo Alto, California. Her practice is also in the same town. It's a pleasure to have her with us today. And I want to say Dr. Robin and I were classmates in our doctoral program. And we always had good conversation regarding body imaging and um, eating disorder issues. So welcome, Dr. Ruth.
Thank you. Thank you,
Pleasure
Dr.
to have you.
Mastajaran. Nice to see you.
So, um, Robin, could you please tell us a little bit about yourself, about your background, where you're coming from, what's your background at?
Well, I imagine we're talking about clinically. So I am a psychologist and I specialize in working with mostly women, working on their body image and eating disorders. So all of my research and all of my work history has been focused around those two things, eating disorders and body image. And my photography background as well. I'm a portrait photographer, have been for over 30 years, and I incorporate my camera into my therapy.
Yeah, yeah. I remember actually you taking very good pictures of all of us cohort when we were together, and it was fascinating to see you in action, and also your special take on how to have the conversation, So I remember this was not just about taking picture, but it was more about having a conversation. And I feel like sometimes you capture the soul of a person in the photography.
Well, thank you, Yazi.
So I also know that you actually have used this technique of photography in your work. And this is a very unique approach that I've never heard about it. This is very unique. And usually our method of conversation is always, our profession is called mostly talk therapy, right? So it's very interesting that you bring another perspective and you bring the visual into the picture. And I would like to hear from you more about the reasons you bring this into your work.
Well, that's a really good question, Yazi, and very dear to my heart. Given my background as a photographer, what I noticed was mostly women never liked their photos. They would always find what they didn't like in the picture. It didn't matter what they look like.
That's very true.
So
yeah, I can attest to that. I hear you.
and so it puzzled me and it made me sad, actually, but I saw it over and over again, and it made me very curious as to why. And it was clear to me it was a social problem, not an individual problem, because it was so pervasive. So I started studying on my own the history of body image and what is body image, how is it created. It's actually a social construct, so it's learned.
Right.
It's and here's the visual piece that you referenced. Humans have a bias for learning visually from birth on. So 80% of our brain is actually using visual information.
That's significant.
That's a big chunk, right? But
This,
yet all the therapies are mostly talk therapy. which is, you know, a different part of the brain talking in words. That memory is different. And so I thought, well, what if, you know, I used portraits as a way to access beliefs about um, the self.
Mm-hmm.
Because what I was witnessing is women looking at their images and all of these stories they had about who they were and what they looked like were coming out, and a lot of them weren't true, but it was their story.
Right.
So it was a really strong catalyst to
So
uncover these
you
stories.
basically called into this, like you were an artist, but then you were called into something different and it called you to do something else, right? Like to
Mm,
think about this photography a lot deeper and understand that you're dealing with a significant issue which is not really talked about often, unfortunately. And you see
mm,
all these messages that women actually are exposed to all the time about what your body needs to look like. And as you and I talked about, you mentioned that a lot of these images are not even real,
mhm.
they're Photoshop. So unfortunately, we're comparing ourselves with something that is not real all the time.
Exactly. And a lot of that is unconsciously operating within us. It's part of our self story. So, how do you change that um, into something more realistic, more positive, more self enriching? So, over the years, I've developed this therapy using portraits as the catalyst to uncover, you know, body image stories, self stories, and to actively use these portraits in changing those stories.
Mhm. That's fascinating.
Mm.
So before we actually, I ask you, I would love to actually know more about this process. But before we proceed, I would like you to tell our viewers. Um, I know that eating disorder is really prevalent in our time, and I'm guessing that with the pandemic and all the pressures that are on people, this issue maybe is been intensified. So what I would like you to do is just sometimes eating disorder can be really sneaky to even diagnose. So tell us more about if somebody, our viewers, suspect that a loved one or themselves have an issue, a body image issue, or more significantly, a eating disorder. Tell us, like, what are the symptoms and signs that they need to look into?
Mhm. Well, to begin with, Yazi, I'll tell you some statistics. Um, so, everyone goes on diets at times, most people do. And the statistics say that about 1/3 of people who diet end up dieting consistently, where it becomes just one after another. And of those people, 20% end up with an eating disorder. So it's a significant amount of people that actually have eating disorders, and they do manifest in different ways. And there's a lot of shame involved in having an eating disorder, so a lot of people won't talk about it.
Mhm.
They keep it to themselves. Um, you know, even with the portraiture work that I did, there was a lot of shame that these women had about their bodies.
Mhm.
And so then imagine having, you know, not liking your body and going on diets and having eating disorder, you know, it's just more reasons to have shame and to isolate
Right.
part of yourself from anybody else. So it can be difficult to identify an eating disorder in yourself or in someone else.
Mhm.
But one of the three signifiers that I start with is, you know, number one, are your behaviors interfering with socializing?
Mhm.
and being with other people.
Yeah.
Another one is your behaviors affecting your health in a negative way?
Mhm.
And the third one is are your behaviors interfering with able to function and take care of your responsibilities? So if you can answer yes to any one of those, um, it very well could be an eating disorder. And um, there's lots of different indicators depending on how it's manifesting.
Mhm.
Um, but typically, the person won't want to eat with other people.
Mhm.
So if you're seeing a family member who's never eating with you and avoiding, dinner time or going to social events where there's food, that's an indicator.
Mhm.
If somebody is always going to the bathroom right after eating, that's a potential for an indicator.
Yeah.
Somebody who upset,
So you're thinking more of bulimia, right?
yeah,
When
right?
they're
Yeah.
purging and yeah.
hmm It's usually right after eating.
Yeah.
Anybody who's obsessing over their weight, their body, or the diet that they're on,
Mhm.
and of course, the most predictable symptom of an eating disorder is negative body image.
Mhm.
That's the one thing that always appears.
Okay.
Um,
So that obsession that you mentioned, does it have to be um, interfering with their functionality, right? It needs to be so much that is interfering with the
i-
functionality.
in one of the three areas,
Yeah.
yeah.
And if it doesn't mean that the person does not have any self-imaging issues, but it means that they don't have an eating disorder.
Right.
Yeah.
Yeah, I think most women have struggled with their body image. That's just been my experience. It's just it's socially acceptable to not like the way you look.
Mhm. Right.
It's less acceptable to compliment your own photo. I always look at the double standards. Yazzie, if you were to look at your picture alongside a picture of a friend of yours, what would you say looking at your friend's picture?
I mean, I would be more loving and accepting towards my friend's picture than towards myself for sure.
And then you look at your picture and it's very different, right? Your response?
Yes, yes, of course. Because I think, yeah, I mean, I think it depends on the person, right? Some people are more. Um, I feel like that response differs, right? But generally, you're right. We are more critical towards ourselves.
Yeah. So we use a different lens to look at ourselves than the lens we use to look at others. And I always refer that to as we take a holistic look at other people, our friends, but we don't use that lens on ourselves. We focus in on certain aspects,
Yeah,
not who we are as a whole.
yeah. So now that we actually talked about the diagnosis, what I would like you to tell me next is that if somebody suspecting that a loved one has or themselves have an eating disorder, what is the best first step to do?
Well, I would try to connect with a therapist who specializes in eating disorders to have that person help determine what level of treatment that you might need,
Hmm.
because there's all different levels from residential to partial hospitalization to outpatient. And so talking to somebody who knows the right questions to ask, knows how to identify the severity,
Yeah.
to know where I should be going,
Yeah.
um,
Yes.
yeah, for help.
Right. And right now, telehealth is also available. I know that because of the COVID, there are a lot of people who cannot physically go to the therapist, but
Mhm.
telehealth is always available. That's an option. and people can go to people like yourself who have the specialty and know about eating disorder. Now, having approach here, I would like to ask you, um, what is your way of treatment? And I know that I want to know about that um, special way of treatment that you have, and you work with portrait. So walk me through an example of a hypothetical person that comes to you. What is it that you do?
So this person is coming wanting to do the photo work.
I mean, or they may not know about the photo work.
Mhm.
So you are introducing that. And I know, like, let's assume that this person does not need a residential treatment. So in that case, they're coming to see you on a regular basis. So what is it that you do? Like, what would you like? How do you approach it?
Well, yeah. See, I think every client is different, and I
That's very,
like I
yeah.
like to think of myself as being a little flexible, a little eclectic in the tools that I use with different people. But I get the feeling that this interview is more about my specialty, which is what I call the photo identity process. So I actually have a name for it.
Mhm.
And that entails, um, getting to know each other first, understanding, what we're dealing with and what is the most important thing to focus on first.
Mhm.
That being said, if it's body image, if it's not a full-blown eating disorder that needs a higher level of care,
Mhm.
if it's gets gotten down to more of the body image piece, the photo identity process is a very good way to address the negative body image.
Mhm.
And that entails having, getting to know the therapist, feeling comfortable with me, and then venturing out for a photo shoot in nature,
Mhm. Very nice. Yeah.
away from the city, out in
Mhm.
the woods, somewhere that resonates with the client.
Mhm.
And the photo shoot is taken. It doesn't take very long. And all along the whole process, there are questions that are being asked for the client to kind of go inward
Mhm.
and to understand what's happening inside of them physically, emotionally, spiritually, what things are coming up, and to start paying attention to those.
Right. So as you're actually doing the photography, you're asking all these questions about how the person is feeling. Um,
Not during the photo shoot, but
okay.
before, after the photo shoot, I like to keep it just between me and the client and nature, and there isn't even a whole lot of talking many times.
So it's you, the client, and nature.
Mhm.
The third one is the nature. I
Yeah.
like it. It's very beautiful.
Yeah, what I find is when people go out into nature, that busy, critical mind that we all, the negative voice that shows up inside, it disappears. And I think that I referenced earlier that holistic view.
Mhm.
I find people become more holistic in nature, um, about themselves and about everything when they're out in nature and away from all the judgments and social pressures, that pop up that social critical mind. So taking photos while in that state of mind creates images that are more holistic.
Mhm. Yeah, very nice. Yeah. I have witnessed that, so I understand how it is. When we were in school together, we had the beautiful campus, and that was part of the nature. And it's actually a different feel for sure.
Mhm.
Um, Now, what I would like to know is um, your practice is online for now because of the situation, and you're in Palo Alto. What
I'm
are
in Menlo Park,
Menlo Park?
but
Okay,
Palo Alto,
yeah,
yeah.
very close to Palo Alto. Yes. So now, what I would like you to tell me is, and tell our viewers is, what are some of the tips you have for people that have self-body image so that they can support them in having a more holistic view of themselves?
So you're asking for tips on how to improve body image? Is that what you're?
Yes, like so basically what I'm want you to tell the viewers is give us some tips to maybe some reading even to kind of work on the issues that you actually presented.
Mhm. Well, one of the things that's simple and effective is changing your reactions when looking at your photograph or yourself in the mirror, and making intentions of saying positive things instead of negative ones.
Okay.
So that's a little, you know, plus just take notice of that damaging behavior of always the negative. And so making a definite intention to stop that. And like if you find yourself wanting to say something negative, stop.
Okay.
Use the lens you use for your friends, the
Okay.
kindness lens. Find the kindness for yourself.
Yeah, and that compassionate, holistic we
Exactly.
yeah,
Why do we lose kindness for ourselves?
yeah,
So that's the goal,
right.
right?
Yeah.
Yeah.
Yeah. Yeah. So the other thing is that for mothers who have daughters, um, what recommendation you have for them? You know, like this is, as you said, is a social construct, but our first encounter is with the parents and our little circle as what they believe about our body and what the messages are.
Right, right. So I would advise parents to not talk about bodies, to focus more on all the other things that make us who we are. There is an over focus on the female body in particular, males too, but in particular female bodies, and to make sure you validate your daughter for all the other things that she is. And if you do detect eating disorder behavior, to act on it fast. Statistics show that the longer you have an eating disorder, the harder it is um, to let go of it. So waiting isn't always the best thing to do. Stopping it as soon as you can is advised.
Yeah. And it could be that it may actually resolve in a year or so, as opposed to maybe needing down the road, needing a lot more, a longer treatment.
Exactly.
Yeah. Yeah.
So speak up. If you think your daughter has an eating disorder, talk to her, speak up about it.
Yeah.
Um, you know, have that conversation.
Yeah, I also remember you mentioned something about being extreme in your choices is another form of disorder. You and I had that conversation. Can you tell us a little bit more about that? Like, going to cutting foods to the extreme and that being part of the eating disorder.
Oh, so you're talking about orthorexia?
Yes, yes.
Okay, so yeah, that's a relatively newer eating disorder. They call it clean eating or orthorexia.
Mhm.
And that can sometimes start out, let's say somebody decides to be vegan, and then after that they cut out, you know, other fish, and then they cut out, some other grains maybe, and before you know it, they're only eating like two foods every day.
Mhm.
And their fear is to that they're polluting their body.
I see. And that comes from a deeper psychological issue, which manifests to eating, right?
Right. So it's a restrictive type of dieting, but different than anorexia. Anorexia is just usually not eating at all. Orthorexia is this, it's justified through my way of choice of eating.
Mhm. Right.
So it's taking wanting to be vegan to an extreme where then you're cutting out all these food groups and you're malnourished.
Yes. So being a vegan or vegetarian, having that choice does not mean that you have an eating
No.
disorder. It's just when it becomes to the extreme of any kind, that's
Right.
when
It,
there's
it can be sometimes start that way. So as a parent, you might just want to watch that if your child is deciding, to have these strict diets,
right.
um, to watch to see, is there a lot of anxiety around what happens if they go off the diet? That's a good indicator. If they go off their diet and there's a lot of anxiety,
Mhm.
that's an indication of
It's interesting that you mentioned anxiety because as I'm thinking about these disorders that we talked about, it seems that the source of all of this is a lot of anxiety and wanting to have some sort of control over. Um, do you feel like this disorder is generally is related to disorder? Is it comorbid with anxiety disorder many times?
yeah, you see eating disorders very common with anxiety and depression.
Mhm.
And you know what eating disorder is? It's a coping mechanism. And we all have coping mechanisms, right? And some of them work well and some of them hurt us.
Mhm.
And eating disorders hurt us. And so under stress, that's how where the person puts their anxiety into an eating disorder.
Mhm.
It's funneled into the eating disorder.
Mhm.
And so learning how to find different coping mechanisms is very important.
Mhm. Yeah, definitely. Can you think of few coping mechanisms, like tools that people can have to challenge this tendencies?
You're asking me what healthy coping mechanisms are?
Yeah.
Well, I think for some people, the feeling of needing to um, escape their reality, uh, then they can focus on something, obsess about something. So why not, if you have that feeling of needing to escape, go take a hike in the woods.
Hmm. Okay.
If you have that feeling of needing to change reality, that's just one example.
Yes.
Um, you know,
Yeah. Yeah. Very nice. Thank you so much, Robin, for your time today.
oh
Pleasure to talk to you, and I look forward to our future conversation
yeah,
together.
yes,
Best of
it was
luck,
great.
and um, talk to you soon.
Thank you, Yazzie.
Take care.
Mhm. Bye.